na ye twaso fonton from ni na se de kan ye ansa na ye ba no afide ye domosoko ewo apomuden ensemu ne de no eye nika ebrosokra if you say on sem bibi ye kapomuden sempe na obi atane educative no je ne mu be ikube ne ekwadu ho mfaso eye exercise nso ye nye bi kuro awe ho nso ye bedi ho dwuma na ne de domosoko no ade a obi etimi kan obi wontimi mfa wani kosua sei enhu nanso na edi nipa ninya mrantie ne maba wai boyfriend girlfriend semi obi timi kotam bi to ne ho so na afei ayensem bibre na oka enye ye no sa no ba adwuma mu a utie o ya enye uti potin na ye ya wakoma ye o ya nye wakoma potin na ye o ya bruni se ye friend no depression na ene menya obenfo kokodrufo a obekirem ama bibia aye kama pa obi ade atwede da ho mighty anene obetam studio ha wafa ne ho so te kama pa di the counselor perfect na ne dibia egu ha de esewani ense okache ntunim me ma ono nkasa ada ne ho adi na yadom wasiko efise brofo a ya twra breme no kasa me ka me ni bibia me free me mpem ho asem na healthy anya basa me da wase cause of mo fidi nda ha eni gese me wo me ne se you streaming live e Facebook so at Kantanka television inti frɛ oyonko se on frɛ obusiafo aka ne depression on sa kan wie no kwan obefa so a obedi so nkonim eno an ho ye den na kwan obefa so obedi ho nkonim so ye bedi ho nkomo oba hema me ma kwa ba
ya obi ade
ai
ni atwede da ho
obi ade me so
troka ho
ai bazuka ba kususi ho
okay
na me bia kama na wadaroma ahofedia eni nkomo kaka obi wo ha ne de kan a ohun ewo ye television yi so down ho di chain bo hu say dibia wa ha
me da say me din ye perfect elom kuma odru mawari into Mrs. Etwato
you know you be the original
oh mawari den me enkwala 3
say you say mawari kwa den ka
oh if do me ensani ntina che say yekrem
hey na professional and it chia ora why ora me say o share
o share pa on na me ba yentino obo mechidom
me ba na me director kai me say omo wari ahemfo no hene no amma itimi boat instantly ehu hia pa
ni na ehu hia enti ye ka counseling ye woni a obi a specialize enti me ko school no me fa psychopathology na e hwehwe wa adwen mu abnormality a e woni pa adwen mu enti bi ni depression na me sanso de family life e de kan ho because empena twen mu nsem ne efie mu nsem no eye no so ha adwen eno so kra timi ma wa adwen ne kra no ebi o ha na niama enkoye etoche timi the family life so ka ho nti ye can counseling dia and the nature say psychopathology mental health crisis abuse and family life den mikromu den e wo Ghana ha and beyond
and one an international woman it's here that counselor perfect say need some okay nyina age say metiasia e ba no adwene mu dia ekuku dampa de udi mu akotene na adwene mu nso ne nim se suban ne nema bebre dedi nti make say kra adwene ni no how timu say obi kasa na brai de na koso nze bia nya steady this adwene mu de wa ben pa ye da se na nso wa be kan ho na counselor ye hyase e wo nkomo mu na tell depression ebuso o ye ti o radio so ye hu o TV so ni bibia den important ye ma me ne nana no mo hwe na mo tiase
se ye ka depression a na ye pese ye kira ne se wa adwen mu na ye ka ni na ye adwen mu e na efiba se wo ho na wa wo se wa tinkam no I say weni enje bibia nyewo wo bibia nwuye wodwuma nhwere o obi enjaye o nanso no wotewa no more than 2 weeks and beyond inti yanka say 2 days bi wa ye basa yankofo using I'm depressed nanso go no ntia say or you stress so say you depressed say wo person okasa wo you depressed clinically proven say wo you depressed it should be 2 weeks and over and also so no kra no ya hwehwe adwen mu no ya assessment ehun say ampa we a depressed person it's depressed ne say what wanna be bien how more than 2 weeks no now we mood e change we need energy wa bibia nye wo nanso wa feel say we ninje ye eniama ye a wotan ye no kra no wonye sa biem wo ra ho wonya kra anka obeku ho na che say no depression no edu severe any suicide na say yes celebrate World Suicide Day, Prevention Day. Bebre na hwehwemu ka che say bebre na do depression na etrape na che so okuno ho. COVID is so ba ye kra de ama depressive mood no adoso. Into depression de eya adwemu na edeba. Eni amanema bi so na ekomu ema obi ye depressed. Into say wadwuma say na 2 days 3 days bi na we ye basa 4 day 5 day 6 day we are okay you are not depressed, you are just stressed. Obi eja no when you broken heart na 2 days 3 days by basa you are just stressed, you are not depressed. Into depression e ba ye ja o na so no abro 2 weeks, 1 month ni na person wo bepie and the fear women men are scam and there ben no keka sa man it's how you look. You see, mental health one critical thing I want to say, the normal way of doing things you deviate from it, you become abnormal. In today be a senior woodidi, senior was shown tire, senior Manchester area cry eternity. Still now what dear one pet sa obeshe bibi. What you mostly have fun doing would jaya. Now one question them, one person will associate it, then it means you are being depressed. But no, just a hospital. Now you share what dream once. The psychiatric, the psychologist, the counseling psychologist, clinical psychologist, we assess you before we can say you are a depressive person. But then yes, idea mostly you are stressed, you are not depressed.
Na any subai trakambe na ewo. What sinipan sanan subai tie. We did so can a yare and wayare. Ban say na chuchu yenya doctor for ya being some way. You be who sa so messy. We then yes say name bibian.
One say you can't person me can free buy in a near a what causes it. One say you won't be more per na awusuomo sanete ye de awono into some chemical imbalance be one adwene mu into na ma they are prone to depression. One say tete no wo kwa ware sibisa into no bi o hwa ebusuani mu no depressive ni wo fa ni wo fa bi ne maame bi ne sewa bi ewo sa yare no mu adwen yare no nti se owo a wo so kwa ware se nipa kon na the possibility say sa adwen no akora ne benya no ho and sure wo nim obi so or you normal, everything is okay. So onyini no na we be a depressive person. Inte no e ya wusu etme de ba. Na situations me kan ebo a broken heart. Ebo wa COVID, Arabia chew, Arabia and cancer, wo ba terminal disease. Inte no na ama depression no abeka ho. Ebi so wa na adwuma mu nsem sikasama enko yie ne nsem eno na ama why depressed. So situation can cause it and also biological factors can also cause it. Into these two things. But one say nipa bia ne se no sifatie, ye were introvert, ne were extrovert. Obo ho oye din oda din onye keka nti be hu se sa na nipa connect ye osisi ohu ni na de bi o hyedem de bia no hyeda na niji kra na onye ne bebre ma nipa hu sa na ote nanso no se ka depression na che se nipa no a oye extrovert and also oye introvert no se no si fatie no wasesa sisi ekra de first in the na nkopie ope football nti ebo footballer oba bonti yin na ye jubilate hwe kakra enye se no ye extrovert obe de ne bebre nanso hu se okeka ne ho se no si fa dress ne sisi so na aduane odi oda kama nanso no eko 2 weeks and beyond ni de bia no hyedem ono pa ya yi ne lala scama no sisi akra de we German efu on treme ne ti hu efu bebre ondi se no si fa dress no on dress se bio okwa adwuma akra se wate ne ho bi who na one say bibi shene so aduane kro ndidi ye is either you eat too much or you eat less obi an competence see that's of funfum aduane bebre
ni na ya reho boni
ni na ya reho nti obi ho didi bebre obi ho ndidi kra na aduane so they have lost appetite obi so with depression no say eyewu kunu a ebo ho ampem agro kra no first na ope see all the man kra na I saw mpebiem or twetwetwe ne ho obi so na why so hyper sexual they be na I saw tata hu wasesa. So if the person change
no can be create depression.
Yes, if the person change once it's to the extreme obi so ope too much if to the extreme you realize say nipa we no or you depressed obi to me all of a sudden nipa is very faithful to you no I start to catch him say I love you wo hwe ni phone so a I so ne nkofo series say di nkomo I'm not happy, I want to end it well, I want to end this life e dey nkra na eji wo wi ase de me ba ye den. If they start asking these questions and realize say and 1 week 2 weeks about it's getting to manta, you should pay attention to them.
Counselor, what kasempa na sa depression e sha say na ye say ya say wa ma yate de ye pote nso so be nso na nya e wa nkwankre so ene o man so de nti na ye asem kese a e wo say nyina ye fa na ye de ani atoso.
One say e ba ne sana say dwuma bi na okokra na they are not productive at work. Because time e che so okwa dwuma no kwa no why late. They are giving excuses. They don't want to share actually what is going with them. Once a mental health, the stigma now account winning to know. Bebre now to me out and beka say na me feeling. Bebre no kwe nimu say depression na cheme and me say. Ebo ejuma na asay no ebo amebusuemu no sa biological factors no ene ha me ena me say. Into no, some people don't know that they even have depression. They are just acting it out. Into ejuma mu no low productivity. Ontimi nye ejuma no se no sifatie. So ye doctor ni are they absent minded. They don't kwen yes or the mouth or the bema. Say cheso your operation kwa they are not so attentive to do it. So a nurse ontimi nye ejuma ye or a teacher ni kwa or a depressed bibi kitu e biko betimi abo akwala no. So na nye onwa.
De oka kwen na just say etimi tu bia.
Etimi tu bia.
Na say wa kra wa bin kra na say wan hwe we etimi tu
bia. Etumitu obia na de ka depression so enye mpanifo nko na enye omo nhwehwem chese nkwala nketenkete na enye omo na esisi ayen lifestyle no so ama bebre na getting depressed. One say nipa no we are not isolated human beings, we are social beings. Internet radebo Adam or man if kan ho so onye obi ni ndi nkomo na esisi an wan hwe o kra wo phone so obetimi ahwe video ni nkofa WhatsApp so you don't have most interaction with people.
Na say nkomo cry na say di nkomo eho hia pa
eboa ya ndwen eboa yandre ma yandre ne emma enijie the happy hormones dopamine oxytocin when nipa kasa wo hage nipa wo striche nipa which ya nsem no it help us as human being. It is how yes me dey matem de bia mia phone so the more screen time that you have in kan kwala no wo ba ma nya screen time be brain na it lead to mental health issues ebi ni depression ebi ni anxiety han kwala no. Inti sa wo ye wofo a better say you screen time no susuma kwalande bi on use tablet. Wo ye panimu so a susude bi a hye dem sa wo ne interacting with your gadget. Try to interact with people. Inti wo ba dwuma mu asre ene nkofo ensre chia nkofo hack people, ask people how they are. One say some aye can it affect us a lot.
Okay.
It affect our mind. So when you go to the workplace, baby, I wanna always say be kind in your words. Obo what they are going through a lot. Make this kind obo onim kra say or depression. Onim kra say this is what they are going through. But no him say I'm not feeling well. I say my thinkum no I'm not well. Enya malaria na ye me, enya fever na ye me body, me physical body ni ba my dream mu and I say I'm not well. So be kind to them. Also why shabbily dress no. E ya den na why you hu seketu we say. You just need to get close to them. Is everything okay? Bibi o ha metimi ayaboa. Then they know say you care about them. It bibi ni kwa they can open up. Say if they're having suicide ideation or person kunu konim say somebody cares about me. So let me hold on to life. Let me not do it. Be positive. Don't be negative towards people.
Dear who here pa counselor perfect ana yenena edin komono for because they hear some boy ni portfolio ni kra. Wa utie nsem na ebobo bana. Tim se mami wa bua ne ho pa ana waba wade nsempa esomien depression dia ha Ghana fo bebre mebusa no na ye nche ya don suko se yete depression wa bonten dia Ghana fo bebre te me ti yo kana se nipa me ne o mana nsensentweni a ti mu se etu atese die baba me musa se omo edom suko no o man hwehwemu bi ehu nipa dodo a ya Ghana ha omo sa die efi se me hu se me ene wo se ti anye ya impo eti ya agesa wo to ansa na hospital inti me ko psychiatry ana me ko bebia ko ma adwemu sebe emergency bi kura mayi ana se bibi inti bia no hospital nipa sa na wo sa na mayi e wo ye ho a omo nam omo hia moa nenso omo nya anteboy nyame ya adom a ene mo hwehwe mo amoye Ghana nipa dodo no e wo sa depression ana ka kra bi ana se ya yenye ho hwehwe
inti se ye hwe Ghana yen stars na wo fa nipa 10 bia jijina ho a wo benya nipa 4 they are depressed. they are having depression. It was a situational depression, obiso a biological depression, near awusuomu wenya. Once with COVID, medical cancer with COVID, near economic hardship, air cost intino, people are experiencing depression a lot.
Economy need to treat me cause.
And say, can inquire, imagine draining Yama, Jume, Yimbi Mwedi, bank issues here by Yimbi Mwedi, Nina, it affects your mental health. Until we have this category of people. But Ghana, no near born to the greater extent, chain abroad, when they say, Yembi before, we have the family system. As you see, and Yembi we person, Bimu person almost saying, Bimu person almost saying, the end of the we have the family system, and Yabi, and obey me from ham, obey me afro of Fabi, obey me afro be, said a church so that yet the mouth, room says, I'm a family, I'm a quick crassy, I'm a baby ada.
Okay.
Menya bibiedi say your mom kwa sorry edwen kokoo no so no at least wo ko obi be yasre sem wo besre obi be bisa say te sen wo benya the interaction between us, the family system and our community. It helps to minimize the depressive issues, but still we have them going on. We have people are having it, but there Yana say people don't know that they even have depression. Because Ghana no bebre na fa ne say ye can adwin mu asem a na che say wabodam. But eno ne nche say wabodam. It's like say wo malaria, you need help. It is say wo nan ya you need help. Say when you stroke, you need help. The same thing is with the mind. If you have depression, you will indra ye de ma antidepressants ye de more fa. Inti ye wondro ho. Yes, also what therapy ho. Obo we draw no fa emoano. Obo ma they have some people react to the medicine. In terms of what types of drug and ye ba kope. Ye wondro enti de we ma na mbo wa ye ma ofoforo ne ama ofoforo ne amofo hu se ebeboa. Obo wa amfa na nto aduro no so a emoano. Because obi wa we ja no na without aduro no. Etimi chemical ne timi ba imbalance ne timi ba no pese okune ho. One share your obetwa ne nsa obeku ne ho anaso obepro bi crampo because of depression na okomu no. Nti e ma waduro to control it. Obi so wa ne de na situational. Ejuma sem abrabom sem environmental issues ama wenya depression. We mostly counsel you say you go for therapy rather. Inti ye de kasa ne nyama because it's all about the mind. Wo kasa no me pepan because you started with say bibia ekore no e adwen no. How you talk, how you walk, atara obehye e wadwen no. It's the mind that is controlling everything. So if we are able to tell the mind say this is how you need to think, this is how you need to act. And so therapy is helping the mind to think right instead of the wrong. Into therapy no so boa obo they need a drone ne therapy obi so wa therapy no nko etimi boa no etimi emma depression no eko, but some people etimi nko kra but they manage it.
Me that's be counselor na buni say lifestyle habits and abrabe na me mo either say me hu say me wo anase obi wo abetimi aboa na ama wetimi edim konim wasade so.
One say if you diagnose you say what depression. First of all, the kind of music you listen to is very important. One say we have melancholic music. Music they are very sad. One share besu movies be how you must try to be happy. Because it's hormones no and yes sir. So you can trick your hormones to be happy. Ebenezer psychology will tell you say when you start smiling, others also smile. When you start smiling, the mind take it that you are happy. The mind can't distinguish between you faking a smile and as a real smile. So when you are smiling, when you are laughing, it takes you say you are happy. So that is the hormone is going to give it to you. Into what you see, dopamine no low. Oxytocin low. So when you start smiling and doing this, it tricks the brain to make you feel say you are happy. So when you are a depressive person, in your so sad, gloomy, you tend to get away from them. And whenever you are feeling sad, when we say Nyama, you are sad, you are thinking a lot, it's best you journal. That is the therapy we use. You journal, write your thoughts down. Write it down, just type it somewhere. And you realize that most people have great music and the rest near from when they are depressed. Once a broken heart and jom paluta bobi yes, they can relate to it. Right? So just journal it, write it down, do something about it, write it. Instead of you acting it out, write it down. You can also talk to somebody, internet counselors, your clients we know that this is what they are going through. So sometimes as late as maybe 12 o'clock, obo to be fro ebo a one o to me fro say I'm going through obi ada no ni dia wa sorry like
papa tia say mausa
ejuma
oti ejuma
oti ejuma na say na ko it because obi fro say senior medwen ho anko I want to end it say wo for friend now one fa when him said this is what the client is going through no him so was this issue or suicide ideation no friend just that is the time o who be say obi entime mo an nti say one person no kasa nti say one tie na adeche na wakwaye ne ho bone a one kasa what will your conscience be so we mostly listen to them so that is the emergency that comes with our work but Nina and we have people we also let them to call. If you are a depressive person, you take your drugs, you do the therapy that they ask you to do, and you always need to associate yourself with positive people and give boundaries for yourself. Some people are toxic. You don't want to say more now you relate to toxic people, no, it affects you.
Toxic, the fabric, and why am toxic for?
In me, also, or how it gets to you. You will be they are very difficult to manage. It is sanko for you need to put boundaries to it. Ebo ana your mommy, ebo your papa, ebo your unia baby.
On and papa bianchro.
On cast and papa bianchro. Ti sani pan hello hi so en hu hia so besra kwatina ni fie. Eni ne din koma manake ka etutu nya me
e because work environment, right?
Work environment. So you need to give those boundaries. About to make a chance say mihia wa si no si fa de bi obi sam ma worry and I won't worry with juma ye basa no mempe. Don't be asking me those things and wame. Be frank and tell the person. Who say nipa kone bu hu na chia no or dem komo hye go off your way because at the end no ono ko ba wo na wo ko fi obedwendwen ho saa na a trigger other emotions from you. Nya san so ka say we a parent wo akwala e ya hwe ne ye ye nkwala outbringing no attachment style ne nyama no so it affect them. Nkwala bi wo ho a omo de omo afado amfantete omo de k ne san akra nyini no they don't feel any self value nti ebenyini no aka na adwum se me kra de me nyobia nti obi ye nbibi kakra bi ape na trigger sa a trigger sa nti de bia na say wa isolate ne ho mo na mu yobi me de me nyobia but be come no they are having everybody is having something unique about you erade ama obia bibi obetimi de aye adwuma adidi erade ama bibia a star in you but it's up to the parents say you nurture that talent of the child to bring it out into your wofua how you train your children help akolebo wa senior maami enfi no jane to papa jane to enti onyini ye no wenya sa depression no efi senior ne tete enkwala tete mu nti ukoware so a susu se obete iti wukuru ne woyire aware mu nsem so etimi di biba susu
counselor dey remember counselor perfect ana ye ne na edin komo kantaka television mi dis ka ware obi ehuri he nya botre unia idi nyina management ene dey be say dey all kano arehobone ana pa I friend depression no nipa bebre ana wo ka se nipa du e wo Ghana no nipa na so nipa du si wa nipa na e wom e bi e wo adwuma mu ha e bi e wo ba bi e ben ya sorry dem ba bi a nti se ohu na o mampanyifo ane ete se ono ene wodi nkomo ohu sine osi ben toto ye no eboa mesrew menku ho ohu hia dodo ben nipa bebre a omudu musunsum omchese wodi ntimi nkoso wodi e ohu furu ban wonye sika de bi ada enwom bi e bai I make the say Minyasika, media 10,000 media to incredible Mr. Jaisanum de Jaito. Now, now won't say Emeritus Cadibus for air for no casempa, na bianco ye and mouth. Counselor perfect and common ide, now so your bread is supper. There in himself a sabbath being Robert Twasso. The moment the meal kind will be an opain and yajipa if it's a wakana, some and a intercept. What are my show I have on the behoo, numbers a bang, website to be ohana, na any home.
Mediani Counselor Perfect on social media. Into TikTok Counselor Perfect. To call LinkedIn Counselor Perfect. Baby, I Counselor Perfect. My number is 0243 28 37 84. 0243 28 37 84. Maybe mapono.
Number says suma ebim na obi hia pa. Na enkus look aka. Ai obi tro. What's keeping the back?
0243 28 37 84. 0243 28 37 84. Medjuma no na so ye wo Ashoman Estate. Na nya me nkwa so na me ye djuma no me wo other counselors a omo so eboa because counseling no ebo obeba no wo pe be ma counselor manabwa ebo also a wodwen say oh we de anka wonya wo krom ni a anka o na ebeboa nti ye hwe ni na ho ansa na ye de aboa ye client nti ye wo nipa bebre. I have other counselors who also come in to help. So you just free and come. We are sorry. We are Jumakuo. You want to talk about mental health. You want to talk about our real matitiene munsem facilitating. Just reach out to the number and call me, and we'll come and help you out.
Oh, medasi bebre. I say Counselor Perfect on all social media handles. Me boy. Medasi nyamisha bebre. Patro sabra. Papa nso ye dasi. Se ubo adwuma ahomache ene enumre mom hia mo anyina no de som Ghana man nyamisha bema abotre de unye biti se mepesi amete heya wo se our lifestyle we bia kama ba counselor sere na fomo ai sa radio ye de parka eto so in check se come be director JT Asen so ye ba habibi ene de koso nyina so ye de bro menko ba bia